the Advocates Day works. I think, see, Stephanie just joined us, Stephanie McCorkle. Most of you have met her. Tries her best to set up appointments with you. We can't always get appointments with both your representative and senator, but usually we can. And if we don't, then we just encourage you to, we'll help you to stop by and try to catch them or pull them out of a committee so you can have a few minutes with them. It's just important to make in-person contact with them to let them know you showed up. And then to just join other people to go visit their legislators. We need to have at least one person who is a constituent of whoever's getting visited. But other people coming along is just fine, and it's more fun that way, and you get to see more than one legislator and how they work and so forth. So we encourage you between your meetings with your senator and your representative to go with others, and we'll tell you how to connect with people in a little while. Sometimes you go to your person that you're meeting with and they're not there because they're in a committee, so you have to go and find them in their committee room, either at the state office building or the Capitol, or the floor session, and pull them out for a few minutes. That works. It's not as rude as it seems. They always expect that. And then we give you a one-page handout for your legislator with a manageable number of talking points. I'll show you an example from last year. I haven't done this year's yet because we're not done. And it has the important thing that legislators are going to want to know, like the bill numbers. So you don't have to memorize those bill numbers and things like that. This is an example. You can't really see it, I'm sure, but basically this is one page. And everything that we're going to talk about is on one page. There's 3 points there. And you will just be talking about the part that's underlined and maybe a bullet or two underneath, and you'll leave that with them. So it's not 3 pages of stuff, and you really want to even take the high level off this page. So it'll look something like this. I don't want you to dwell on it because the content will be different next year, but that's what it looks like. So when you meet with legislators, usually we go, unless you're an experienced person, and some of you are, we usually try to have you go with a buddy, either myself or Stephanie or one of the more experienced volunteers. Normally you get 10, 15, maybe 20 minutes per legislator. What we encourage you to do is take those talking points I just mentioned, and you'll get the content of them. You just won't get the handout, but you'll get the content today. And just go over them at a high level, but leave a generous amount of time, at least half of your time, to talk about your personal interest in children and why you're there. Some people are there for different reasons. Some people dealt with child protection in their professional lives. Some are survivors of, being in the system or being abused or neglected as a child. Some are just interested in children. But just to talk about yourself, it turns out from experience that's what makes the difference. That's what gets legislators to pay attention to our agenda, is what you tell them personally about why you are there and why you care. And then if they come up with questions that are too deep in the weeds, just write them down and give them to us, and we'll follow up, either myself or Stephanie. Or there'll be some other people, there'll be board members there also that you can talk to. And just a couple of tips for your legislative meetings. You want to introduce yourself as a volunteer with Safe Passage for Children. And then any other related role, like if you're a teacher or guardian ad litem, a retired person in one of those roles, a survivor of abuse, neglect, whatever related role you have to Safe Passage. Describe the bullet points you get on the handout, and again, your personal reasons why you're there. That's the most important part. And again, slow me down if I'm doing too much here. And then other things you might keep in mind if you've talked to, I know, for example, Mark will bring this up, other people in the district, he's talked about who have some of the same concerns, because that leverages your impact. Most legislators aren't on the committees that we deal with. We go to legislators that are your legislators, where you're a constituent, and that's helpful just generally to get these issues out there and make them aware, and also if some of the things we're supporting go to a vote for the full House or Senate, we touch as many people as possible. But they won't know the issues in detail, probably, and they'll look to you for information or to raise questions that I can follow up on later. And I'd say, we'll try to get these bullet points posted ahead of time, or send them out to you, and then if you there's some things that are still actually floating in the air and may land at the last minute, so I'm hedging a little bit that we'll have the handouts in advance. We might possibly just have them the day of the session. But generally, like to get them to you, and then it's always helpful to practice your comments, out loud. Is what I do. I've always done that. So those are some tips. So what I wanted to tell you about is what we are supporting this year, and they go into two categories. There are bills, and that means they start with the legislature, but they don't have the governor's, they're not in the governor's budget yet. And the big one is what's called Great Start for Children. That is a bill that we will talk about a little bit more in a minute, but it's the biggest bill probably in the session this year. We're also supporting another request for the legislative auditor, and this time is to do a deep dive into racial disparities in child protection and foster care, to try to get some analysis of what things that we can cover, we can deal with in terms of practice or legislation or guidelines or other steps in the process that would help reduce racial disparities. And I'll slide on that in more detail later as well. And then there are some things in the governor's budget that we are definitely supporting. And these are areas where we just need to build up infrastructure, we need to build up resources within child protection and foster care. One of them is called the Child Welfare Training Academy. And more that later, Guardians ad litem need some staff, and so do public defenders. So we'll get into that here. So the Great Start bill, if any of you know Dave Pinto, he's my representative. You may have run into him. Yourself, I don't see any of you on the call here who have him as a representative. But he's a great early childhood person. And there are two major chunks to his legislation: early learning scholarships and targeted home visiting. And we have supported these two programs for the past several years because they are among a handful of programs and services that actually have good research showing that they reduce the incidence of child abuse and neglect. So the people who get these two services, the number of them that end up getting referred to child protection and the child protection system is reduced by anywhere from 25 to 50%, huge numbers, and they're kind of gold standard research behind them. So that's really a place to invest state money. And so what Dave Pinto's bill has is essentially criteria that say who is eligible, and it's people who are kids who are in relative poverty, like 400% or less of the poverty level, but also have some high risk factors. And we'll go into that a little bit more later. But basically, it would be a huge number if he got those eligibility criteria to be accepted by the legislature and the government. It would greatly expand the number of kids who get this service. There's not a number in terms of what that bill would cost yet, so he's laid out who would be eligible, and then there will be someone in the legislature will be tasked with figuring out how much that would cost. Secondly, it's targeted home visiting. Again, this is a program that has reduced maltreatment, and it's essentially parenting skill training and other social service supports for high-risk pregnant women. Many of the programs only deal with first-time moms, but there's more programs coming into the mix that deal with moms who have other kids. And they are asking for another $23 million in 2020 and $41.6 in 2021. So some pretty substantial increases. Over 2,800 additional families would be served over the next two bienniums. So those are the two that we are really getting behind and have in past years. And that's been, that's been pretty effective. The next one is the Child Welfare Training Academy. Minnesota has one of the smallest training units, in the country. There's only about two small units at the state level. And so if you're a new child protection worker, you generally have to wait about 9 months to get into training. And the difficulty with that is that if you're out in Cass County or something, or you're way down in Fillmore, by that time you've got a caseload, your supervisor's training, you don't bother to go to training. And so that's a big factor in terms of why there's there's a lot of inconsistency in how people do practice in Minnesota in terms of how they actually work in child protection and foster care. and that's an important part of it. So by getting a training academy that is similar in size to other states, we will have a lot better quality and consistency in terms of practice. This is a bill that, if you were around last year, almost made it through the legislature and got hung up in all that mess at the end where the governor vetoed everything. And it didn't go through. But this year, the governor is supporting it. It wasn't in Governor Dayton's bill, but it is in Governor Walz's bill. And it's got support in the House and Senate, so we're pretty hopeful that this will go through. And this is something that has been worked through by the University of Minnesota and the State Department of Human Services. I think they've got a really good proposal and a good plan, and it's well documented with numbers and everything. So I think it's a quality proposal they put together, so we want to support it. So that's that one. And then we've worked closely with the Guardians Ad Litem over the years. I think most of you know what a Guardian Ad Litem is, or have actually been one. And they have been affected by, caseload increases across the state, and have been asking for more staff for several years. But this year, the governor is supporting it, and he's putting $10.9 million in the budget for 45 additional Guardians Ad Litem. So there's the governor has it, and it's both in bills in the House and Senate, and so we're hopeful that's got enough support to get over the top. So if you look at that top bullet, they are, the number of screened-in maltreatment reports has increased 50%, and the number of findings of maltreatment by 90% since 2013, but the Guardians haven't gotten more staff, so that's why that's a priority. So these are mostly kind of infrastructure things, basic things that this and the training academy that you kind of need just to do the job. And it's been neglected for a long time, and so we're really going to help push for that this year. And then the public defenders is another major part of the system that has been kind of left behind and just scrambling to get enough resources to do their job. And so the governor has put, over $10 million for next year and $21 million for the following year. So that'll get the public defenders back up to speed. I think both the public defenders and the Guardians will then have the level of staff that they need to handle their current caseload. So if we get that, it would be great. Of course, governors ask for a lot of money, and there's a lot of skepticism in the Republican-controlled Senate about spending more money. So it remains to be seen what's left by the end of the session, but you got to start with it in there to get something by the end. So I want to take a little bit of a detour here and talk about past successes and how they have affected where we are today. Because I think we kind of lose track. We're sort of like we're halfway up the mountain. We don't bother to look down and see how far we've come. One of the things that I know from spending about 20 years in government management jobs is that government has a lot of inertia. And as it turns out from the literature about organizations, a lot of big organizations have inertia. And that just means that basically once they get in a certain track, they tend to keep going in that direction. It takes some major development to knock them into a new direction or a new path. So that's usually a bad thing, but sometimes it's a good thing. So when we talk about the early learning scholarships we talked about a minute ago, Safe Passage is a member of a large coalition called Mini Minds, and that has been the group that has been over 100 organizations that has been really pushing on these early learning scholarships. And over the years, they've gone from about $10 million in the budget to over $140 million for the biennium. So their efforts have worked, and there have been a couple of years where essentially they have pretty high-level people lobbying, but our volunteers were the only ones kind of on the ground reminding people at the legislature this is important. So I think we've made an important contribution to this conversation. Another major thing that we were a part of, and we can't take all the credit, but we certainly take a chunk of the credit, is to change the eligibility criteria for these scholarships. So these are scholarships to like an early Head Start program or some other quality child care program. And there's just lots of literature that shows that this really helps children developmentally, helps their brain development, and also reduces maltreatment in the home generally. And up until the year before last, you couldn't qualify for an early learning scholarship until you were 3 years old. But as you may know, if you've had any kind of contact with child development issues, brain development is 90% of brain development has already happened by that point. And if a child's in a situation, particularly neglect, where they're not getting much stimulation, their brain doesn't develop the way it should. And by the time they're 3 years old, it's pretty much too late. So they've already passed some opportunities for brain development that they can't easily get back. So what we did with Mini-Minds and as part of Mini-Minds is get the criteria for who is eligible for these scholarships down to birth. And so now children who are between birth and being up to 3 are eligible with a target population that gets priority of children who are in child protection, foster care, homeless, or teen parents. So we've gotten those scholarships focused on that youngest group of children who are at the most risk and have the most at stake in terms of child development. So that's probably the biggest policy impact that we've been a part of since Safe Fastest started. And I just want to share, I hope you all can see these numbers, but the bottom line, just look at the bottom where it says total. So the number of kids who got these scholarships in 2017 in the target populations, those 4 I mentioned, the teen parents, child protection, foster care, and homeless, went from 1,278 up to 3,269. And the goal is to get up to 30% of all scholarships, which would be over 4,900. So we're well on the way to doing that. And again, that's because of this policy change that has this target population and the younger children. And then, yes, Greg's got a question.
You talk about early working scholarships. What kind of programs are the scholarships providing access to?
Good question. What kind of programs are the scholarships providing access to? You may know that there's a rating system in Minnesota for child care, and it's a 4-star rating system. So early Head Start would be a 4-star system, or a number of kind of child care centers that are really buttoned down. So you have to be a 3 or 4-star center in order to get this scholarship. So they're all pretty high quality child care settings. And then that's a problem. Some places are deserts of those kind of programs, particularly in rural Minnesota. But you can be pretty sure that if a kid gets one of these scholarships, that they're going to a place that'll make a difference. So thanks for that question, Greg. And then, so as you see just on the left, the target groups are children of teen parents, children in foster care, children experiencing homeless, and open child protection cases. And let me pause just for a second and say, is this all, am I going too fast, or is this making sense so far to people, or do you have questions? You can send me in. Go ahead.
How do I talk?
So, okay. So this next one is, I was talking about only 3 and 4-year-olds and 5-year-olds would qualify for these before, pre-kindergarten. And now children from birth to 3 qualify. So if you look at the bottom, that 3,269 number is the same one you saw in the last slide. That's the total number. It's going to these target populations. But 719 of them were for children from birth to 1-year-old, 490 for 1-year-olds, and 506 for 2 years old. So that's what, about 1,700 kids in those earliest and most vulnerable periods of time who are getting an early learning scholarship and hopefully developing, better than they otherwise would. So these are some things that have actually happened, and there's more to come as a result of some of this advocacy. I'm going to let you look at this one online if you want, but it's a really neat slide which really shows the impact of, what happens during the first couple of years of life in terms of language and other cognitive skills, and the impact that, if you don't get normal development, those things just don't happen. Another thing that has happened as a result of our advocacy work is that the state is spending more money on child welfare. And I need to back up a little bit. I didn't put this on a slide, but many of you know that in 2015, the governor had a task force on child protection, and which I was a member of. representing safe passage. And one of the things we got changed in that as a result of the task force was that all the counties had to follow the same standards or the same guidelines in terms of responding to reports of maltreatment. So prior to that point, and this is what the legislative auditor study that we got done demonstrated. Prior to that, there were guidelines the Department of Human Services sent out there, but they were interpreted in a wide variety of ways around the state by different counties. So we got a law into statute which said that the Department of Human Services is responsible for setting guidelines, or we might just call them standards, for responding to that initial maltreatment report, and the counties have to follow them. Before that started, counties on the whole were screening in or responding to 27% of maltreatment reports, and the average nationally was over 60%. So we were responding as a state to fewer than half as many reports as a typical state. That went from 27%, as a result of getting this into statute, it's up near 50% now. And so, and the national average is around 60. So we're getting close to the national average. But what that has meant is that it's brought a lot more kids into the system. And some people think that's a bad thing, but it seems to me that we're responding to kids that we should be responding to all along.
Come here.
Yeah? Oh, hi. I'm not sure who that is, but could you mute while you're talking?
Oh.
Yeah. So anyway, I'm going to show you a slide next, which is probably inscrutable, over the internet, but you can look it up on, on the internet if you want to look at it. But what it basically says is the state contribution has gone, well, over the total in terms of how much is in the program, it's gone from $374 to $644 million. So, maybe 70 or 80% increase. The state contribution gone from 90 million to 167 million. Counties have added their money, 215 to 278, and the federal government has gone up about 63 million. So the thing to know about that is that the state numbers are driven to a great extent by entitlement programs, not the fact that the legislature appropriated money. So what this is basically is that when a child comes into child protection, if they're financially eligible, then some of the services that are provided are 50% funded by the federal government. So if you spend the money at the state level, it draws down a bunch of federal money as well. And counties and the state have to spend money once kids are in the system. So even though we only got a $50 million per biennium increase in the state budget, there's been, let's see, that in about almost $250 to $300 million increase overall. And here's the chart that you probably can't see, except if you just looked at the trend line on the left, the bar graph is 2012, and on the right it's 2017. You can just see how much it's grown. And that sandy colored part is the state, which has grown quite a bit. So just by bringing more kids into the system, hopefully appropriately so, it's also increased the overall funding. And this shows us child protection staff increase around the state. So in 2013, it was 784, and with the governor's task force in 2015, there's a big bump there. And then all the new federal money coming in. We now have 1,253 caseworkers statewide. So these are all just results. As I say, it's about government and institutional inertia. Once you set some of these things in place, they just keep going. And if you set it up right, that's a good thing. Now, you're not going to be able to see this screen. I'm just going to, I don't think, but I'm just going to show you, point you to the green wording at the bottom where it says the number of maltreatment reports received by Child Protection is up 25% since 2013. And if you look at if you look into the Minnesota, it's the light green one, and it kind of looks like a jet taking off. So there's been a big increase in maltreatment reports, and the reason that's significant is because, at least anecdotally from everything I've heard, mandated reporters had more or less given up on reporting to Child Protection in many parts of the state. My wife was a school social worker, and she would call on certain families so many times that when they picked up on the other end, the screener would say, "Oh, it's you again." And we did some analysis and showed that many kids were being reported 5, 10, 15 times before Child Protection responded. and there's other data out there to that effect. I think mandated reporters just said, I'm going to handle this myself, and didn't bother reporting. So once there were some standards for responding to that, and counties started responding more predictably, they came off the bench and started reporting again. And then if you look at the bottom line, again, the green part, it says Minnesota is screening in almost half of reports received in the fiscal year 2016, and you remember we started at 27%. And this has led to a 50% increase in the number of children who are screened in during that period of time. So again, the one piece of that chart on the right that looks like a jet taking off is Minnesota's increases. And then, I hope I'm not going too fast, but I think I just want to highlight a couple things on these particular charts. These are from the state. And at the bottom in the green, it says Minnesota, 90% increase in determined victims of maltreatment since 2013. So our take on this is that more kids are being responded to appropriately, kids who were screened out, not responded to in the past, and they're getting service. Not everybody, as we will find out in a minute, agrees with that analysis of it. But we think that these are the lasting and cumulative results of some of the work that's been done.
One qualifier.
Greg is here. Let me put this.
One qualifier on that is that that increase on maltreatment would only be for cases that are traditional investigations.
Right.
Because on the family assessment cases, track cases, there is no determination of maltreatment or no maltreatment either way. It's neutral. So part of what that represents, I think, is more cases are being assigned to the investigative track, which by nature of the definition of what's appropriate to go to the investigative track has a higher likelihood of being a finding of maltreatment.
Right. So
there's another asterisk that I think goes with that increase.
Right. And I don't know if you don't know the system too well, if you can track that. But if I can, flesh it out a little bit, Minnesota has two tracks. You can either get assigned to a traditional investigation or a family assessment. And what Greg is saying is that if you're assigned to family assessment, there's no finding of maltreatment one way or the other. And so if there's an increase in the findings of maltreatment, it's probably because more kids are being assigned to that traditional track. And it has a lot of consequences, which we could spend an hour talking about. But it is something you have to, it's a little nuanced, but I think essentially from the research we've done with the University of Minnesota and from some of the other materials that have come out from the task force, there were a lot of kids who should have been more serious, taken more seriously and getting more services at work. So I think what we're seeing is that some of that is happening. Doesn't necessarily mean that we're getting it right. So one of the main things that people are concerned about is racial disproportionality in child welfare in Minnesota. So you see these numbers: Native American children 10 times more likely than white children to be maltreated or found to be maltreated. African American children 4 times. Native American children 17 times more likely to be in foster care. African American kids 5 times. So there is a certain concern in parts of the African American community, particularly, that kids are being screened in disproportionately who maybe don't need to be screened in. So that is something that I think really requires some attention, and I think that things like the Training Institute and other quality measures really need to focus on this. So I'm just going to mention once more. I think it sounds like someone is on another line, but if you're on and you can mute, that would be appreciated.
Thank you. That's making it hard for me to hear.
Yeah, okay.
Rich?
Yes.
I'm not sure if it's me, but I'm not sure how to do that. How do I mute it? I haven't done this before. So do I go up to audio?
Yeah, go up to audio and it'll tell you to mute.
Oh, are you talking about on the computer as opposed to your phone?
Rich,
yes.
I found how to mute it. I was afraid to mute it because I was afraid I was going to cut you off, but now I know what to do.
Okay, good. All right. So those are the things we've worked on in the past that have worked out. And a lot of this you don't actually need for the legislative session, except I think it's important to have some context as to what these sessions and these visits have actually resulted in. So you can be encouraged that this is really a worthwhile thing to do. Even though the state government has increased its share of what they contribute, we're still at 26% from the state government point of view, which is the second lowest nationally. And what that means is that the counties have to pick up the slack. So the counties bear a much greater burden, financial burden of this program compared to the average states. And then there isn't yet any funding for some really core components. There's a big increase in foster care, and there's not an increase in the rates. There's a complicated new formula that basically means that foster care families that took some of the really most difficult kids who otherwise might be in residential treatment are getting less money, so some of them are dropping out. So there's a need for some money in foster care rates. There isn't any specific new money dedicated to child protection foster care staff, although some of it's gotten picked up with this new federal money. And we need child care for foster parents because many foster parents work, and so they can't take kids unless they're older or they have certain, if they're in school. County attorneys haven't gotten anything for quite a while, even though their caseloads have increased. We need money for foster care recruitment and training, and we don't have a very big quality program in this state. So you can train and you can have standards, but if you don't have a quality program to follow up and see if people are doing what they were trained to do, then it can, still not be a very tight program. So these are some unfinished business things that we're still going to be working on in coming years with regard to the budget. And then there's unfinished business in terms of practices as well. As some of you know, the Governor's Task Force in 2015 came out with 93 recommendations, which seems like an overwhelming number. But it really grouped down into about 8 categories, so it wasn't as bad as it looked. But a lot of that was around practice changes that were recommended. And they have, for the most part, not been implemented. The counties and the State Department of Human Services philosophically didn't agree with some of these changes. And so we are still going to be working on that in future years. This is not a good year to do that because there's been a lot of resistance to these changes, and we thought we were focused on other things, but we are not planning to forget them. So some of the practice changes that haven't been implemented are around fact-finding. The Department of Human Services was directed to find a fact-finding kind of curriculum and train workers around the state in it. They haven't done that yet. There was a strong recommendation to stop the practice of interviewing children in front of the alleged perpetrators, and a strong recommendation that even if it was a family assessment case and there was no formal finding of maltreatment that goes into a registry and all that, that there be some place in the computer system where the caseworker could say whether maltreatment occurred and who was the perpetrator. So then in the future, if another case came in, you could see that history. There are others like this, but these are examples of practice changes that have not been, shall we say, have not been embraced by the counties in the state. There were a number of reports, or about 24 reports that the task force recommended. Many of them have been delivered, but they're in the state annual report, which comes out, like for example, the 2016, the 2017 report came out in November this year, so some of that data is almost 2 years old, and much of it is not broken down by county. So it's pretty not very useful in terms of management or in terms of the public seeing how things are going. So a lot of those reports have not been delivered in the way that they were recommended. And we had recommended some real basic level of infrastructure. This is kind of a whole seminar in itself, but to start measuring outcomes at the child level. A child can come into the system and we know how long they've been in and how many times they've been in foster care, and whether they've been visited once a month, but we don't know if they're back on track developmentally in terms of their cognitive and physical development. We don't know if they have behavioral issues, if they're improving. We don't know if they have a high level of trauma, if that's come down. So one of our long-term goals is to start measuring outcomes at the child level. and then to implement a thoroughgoing continuous quality improvement program, which is, again, a subject for another seminar. But the basic idea is, after you train people, you need to go and follow up in cases and see if it's working, if people are doing what they were trained to do. So that's a lot of unfinished business. I do want to say that there is some possibility that a bill will be introduced in the next week or so that will address these issues. And there's a meeting with the governor on Friday, which we've been helping to staff and get ready for. And something may come out of that along these lines. And if so, these things will pop up on the handout for you to talk about. And we'll have to do a quick regrouping on Day of the Hill and tell you what that's about. But generally speaking, this has been an agenda item that is future so far. And hopefully, maybe we'll get lucky and it'll get introduced this year by someone other than ourselves. Okay, so now we're talking about the Day on the Hill. There's the Capitol. This is the Child Advocates Day at the Capitol. And logistics are to meet at the Capitol at the Cass Gilbert Library, which is room 317A. It's really kind of, you have to get, it's not even clear what the third floor is in the Capitol. So you need to leave yourself some time, make sure you're on the right floor and go down the right corridor to find this room. And we're going to have a session from 8:30 to 9, and then one from 12:30 to 1 with a little refresher course and any updates and time for questions. We'll be there longer than 8:30 to 9, but generally your appointments will start in the morning, 9 o'clock, or a little after, and the same in the afternoon. Will start 1 or later. So we want to get those refresher courses in during that time. Or if you can't make it to that, or let's say your first appointment's at 10:30 and you don't want to come at 8:30 for this, then we'll connect with you outside the office of your first legislative meeting 10 or 15 minutes early to go over anything that's changed or ask questions or refresh you on what the talking points are. And we'll have the name tags and the handouts and all that available. This is the Cass Gilbert Library, so you will be able to luxuriate in this fine new room in the Capitol. It's a nice spot for us to meet. And as I said, leave extra time. There's new rooms and new tunnels if you haven't been down since the Senate got built. On our website and on the materials we send out, there's links to parking options and that kind of logistical information. And if you haven't done it yet, we encourage you to take time to check out the beautifully restored State Capitol and the new Senate building. They are fabulous. They've done a wonderful job of restoring it. It's something for the whole state to be proud of. And then if you're out and about and people are running all over and you don't know where we are, here's our contact information. You can call, text, or email one of the three of us, Lois, my wife, or Stephanie, or myself. And if you're in the state office building, particularly with those 3-foot deep granite walls, sometimes the cell reception is poor, so keep trying, find a window, and you'll get to one of us fairly soon. And then if you want to tour the Capitol, here's some information on tours at the Capitol that you can ask them when they begin. They start at the top of the hour and you go to the information booth in the main floor and sign up. So I kind of went through that quickly, but I did want to leave time and for Q&A or for follow-ups on some of this stuff. So so the floor is open.
So Rich, how can I find the charts that you were showing today? I'm on my phone, so I didn't see anything.
Oh, okay. So we're going to post those. I just wanted to get through today and see if there's any feedback to improve the presentation, but we're going to post those on the website probably, I don't know, Stephanie, next day or so, I would think. And you'll be able to spend more time with them.
Okay.
And also, we'll post the recording, and then you'll see what we just did.
Okay.
Rich?
Yes.
Rich, I want to get clarification regarding the early scholarship available. Is that early childhood scholarship available to all children if they're eligible, and then they're just prioritizing those children in child protection or foster care, the 0 to 3-year-olds?
Right, so the general eligibility is financial eligibility for children up to when they go to kindergarten. And if they're under, I think it's 200% of the poverty level, and then up to 200% of the poverty level. And then within that, the policy has been to prioritize those 4 target groups and to essentially try to set aside 30% of the scholarships that are available for kids in those groups, homeless, child protection, foster care, teen parents.
Okay. Thanks.
And so, so that would be the 4,200 and something number that they're trying to get up to, which would be 30% of the total number of kids.
I see that you're focusing on foster care, but an in-home service or foster care and various child care programs. Do you promote any home visitor programs?
Yeah, that was one, Mark, of the 2 main things that we were promoting, and I'll try to get back to that. It's a ways back. Yeah, so the 2 main things in Dave Pinto's bill, the Great Start for Children bill. Did I just go by it? Oh, yeah, thanks, Greg. So the 2 main things in his bill are the early learning scholarships, and that's what we just talked about, and targeted home visiting. So that's what they're asking for. But what the governor did was to keep there was an increase for the next couple of biennia that was baked into last year's bill. And I think it increased things by a total of $33 million. So he kept that in the base, which is good. He didn't revisit that. But on top of that, what they're asking for is $23 million more in 2020 and 41.6 in 2021, and that would be 2,856 additional families. So what the House and Senate bills are asking for is more than the governor put in this budget.
But these programs, do they use just public health nurses? Is that all they do, or what?
No, it's a combination, and it's funny you should mention it because it's been a matter of great controversy and a lot of negotiating for the last 5 years or so. There's a coalition called the Minnesota Targeted Home Visiting Coalition, and it includes public health nurses, local public health agencies, but also organizations that do home visiting that are not a part of that world. But they tend to have a better track record in terms of reaching minority communities and also rural communities. So the gold standard kind of program is called Nurse Family Partnership, and that's all based on public health nurses. But as I say, they sometimes aren't as good at reaching particularly rural populations because there aren't a lot of public health nurses or certain minority communities. So what they've done gradually is widen the tent to include not just these gold standard evidence-based programs, but programs that are very similar and well implemented, but are promising practices or evidence-supported programs, not quite up to the gold standard. So the trade-off is, being able to reach all the communities you want to reach versus having a model that is, got all this research behind it. They've been very thoughtful about how to expand this, and the Targeted Home Visiting Coalition has their own kind of criteria for being a member of that coalition and at getting access to the money. And those criteria essentially are around some of the same quality standards for curriculum and visiting and keeping data that the Nurse Family Partnership Gold Standard program has. So they're trying to really bring everybody along to a fairly high level. And I think that's part of the reason that they do get consideration in these budgets. Does that answer your question?
Yeah. I'll check more with you later.
Sure. Let me just ask one general question, and I'm not closing off to anything you might want to say, but when I do this each year, I tend to cover not only the bare points that we're trying to lobby on for the particular session, but also quite a bit of context in terms of where we've been and where we're going, and other relevant political considerations. And I guess I appreciate a little feedback about whether all that's helpful, or should I just kind of zero in on the 6 bullet points that we're going to talk about on Day on the Hill, or on Child Advocate Day at the Capitol.
Well, I have one more. You've talked before about the reluctance of the Child Protection Services to change the way they interview children, that is, not privately. And this is a tradition there with some research, and they seem reluctant to change that still. Is that right?
Yeah, they are. And I think one reason for it, frankly, is that there are some concerns, particularly in the African American and Native American communities, about this practice. And I've, I think that there's kind of a political view is that, that caseworkers, going into African American families may not understand the culture and may not respond appropriately. But I've also talked with, I've kind of talked with about 5 or 6 professionals, African American women I know who are like program managers or running programs in the community, who are not mainly coming at it from a political point of view, but more from their personal experience and as professionals. I'm hearing the same concerns from them. So I kind of think it's not just kind of a political stance, but each of them shared with me some personal experience they had where their child was treated differently than other kids in that situation. Something as simple as there's a fight in the playground at school and the only kid that gets detention is the black kid, that kind of experience that they have. And so they all have, as professional social workers, they all understand and agree with the idea that you're not going to really get good information from a child if you interview them in front of somebody who may be hurting them. On the other hand, they're not comfortable with somebody taking the kid off into another room either. So we have to work our way through that issue and come up with a way that where the child isn't sitting in a situation where they're being intimidated, but we also don't have a situation where people are worried that the outcome was skewed in some way. Does that make sense?
Yes, that makes a lot of sense. I'm glad to hear your experience.
Rich, I have another question also. When you were talking about the targeted home visiting, and you have the piece of information here that both of these targeted home visiting and early learning scholarships are evidence-based, 25 to 50% fewer families enter child protection. Is that data what they have now showing that, or is that aspirational?
Oh no, this is data that's been out there for quite a few years now.
Okay.
And so there have been studies of, there's a study in Chicago, a particular program that is basically some high quality child care programs. There's been Early Head Start, which deals with the younger children, and similar programs. And so there've been quite a few studies over the last 15 years or so that have shown pretty similar results. Not all of them at the very high level. I think the Nurse-Family Partnership, I think the number is actually 49% reduction in families that enter child protection. But the other, the lower end of that is around 25%. And also it shows if families have been in child protection, a significant reduction in recurrence, so they don't show up again. So those are well-established studies. The difficulty is if you want to say, let's say you want to do home visiting in the Hmong community, the Somali community, or even African American communities, the research dollars don't tend to follow those smaller programs that deal with specific communities or populations. And so, and the models haven't been well adapted to situations where it's not a nurse delivering them. So it's taken a while to get the curricula that they use and the kind of support services they have to be more like what the Nurse-Family Partnership gold standard model is, without having to have it delivered by public health nurses, and giving more flexibility to reaching out to different communities.
Okay.
So again, you know, you don't have to answer this, but I'm just kind of looking for feedback about whether giving you the whole big picture and the history is helpful, or is it like too much information and you'd rather just focus on what we're doing this session?
I think it's helpful. The more you repeat it, the better you understand it.
Yeah. And I don't think there's too many, as many chances as I'd like to, you know, to talk about this with all of you. But anyway, let me stop. Anybody else want to comment on that?
Rich, I think it was helpful too, because I don't know that much about this, so more context is better.
Okay, that's Judy, right?
That Katinka.
Oh, okay, Katinka, great. Okay, good. Any other questions?
Well, I agree. This was helpful to give more detail here, and it prepares me for the legislators.
Right. And again, you know, if they ask you a question you don't know about, just write it down and say, I'll get back to them, or Stephanie.
One thing that you've talked about in the past is that the CPS has had trouble with high turnover in their programs.
Yeah.
Has improved any over the last few years?
Good question. Hennepin County has done very well with that issue. Hennepin County has done a lot of things. They put quite a bit of money into the program. They brought in new leadership. They've done more training. They now have over 40% of their staff are caseworkers of color, and they put a lot of their own money into a couple million a year into child care for foster parents, so that foster parents who work and take in younger kids. They've just done a ton of stuff, and the latest research, not research, but statistics I've seen were that there was a significant reduction from, you know, I don't know, they were like talking 100% turnover per year, and now they're down to more, you know, normal numbers like 10 or 20%, something like that. I don't think the same is true. It's very hard, Mark, to get data from these counties. There's 84 local child welfare agencies, and you would have to go and research every one to answer that question, which neither we or anybody else has the bandwidth to do. But anecdotally, I think that Hennepin is the only one that's made a concerted effort on that point, and I do hear that Ramsey County continues to have serious problems with that. I'm not sure about the other metro counties. You know, I don't think that the Dakotas and the Anokas are as bad.
Would it be helpful if we approached our county leadership?
Yeah, that's one thing that's on our list, you know, when we get to the big and robust in terms of staff, and we do some of that. We've done a fair amount of just talking with Hennepin and Ramsey County, but the first few years we would track those budgets, and we have volunteers go to their budget hearings and meet with all the commissioners, and we couldn't pull it off. Mark, if we get a little bit bigger, we're going to go back there, start doing that again. I mean, we do work with the counties. What we don't do is, with Hennepin and Ramsey, we don't have volunteers go visit their legislators or their county commissioners, because we just don't have the ability to schedule all those appointments. But we meet with, I meet a couple times a year with the top management over at Hennepin now, and there's a couple county commissioners that I keep in touch with in Ramsey County, and then we've met a couple of times with the new county administrator there. So we keep our hand in, but it would be way better if we could have volunteer advocates go also meet with their commissions. It would really improve our ability to impact those counties.
Mm-hmm.
So, any other questions? Okay. You know, we did it in an hour exactly. I think I should get a sticker or something, you know, for that. So again, go ahead.
Oh, Rich, I was just going to say, you suggested at the beginning that I email you or Stephanie to do like a more in-depth orientation. Okay. I will do.
And I didn't hear the rest of it. You asked me how do you do that?
Oh, no, I said I'll do that.
Okay, yeah, because on the website there's contact us at safepassage.com. Yeah, so we'll do that, and we'll try to work that out between now and Dan Hill. And welcome to the group.
Thank you.
It's great to have you. Okay, well, you know, if you think of something that you wanted to ask and whatever, just send an email. And as I say, we'll have a little time to catch up just before the day starts a week from Tuesday.
Okay.
All right, everybody.
Sounds good. Thanks,
Thanks
Rich.
for joining us, and we'll see you in a week.
Thank you.
Thanks.
Thanks, Rich. Bye-bye.
Thanks, everybody.
Bye.
Thank you. Bye-bye.